Hello, today we are going to talk about oxygen therapy. This is important whether you're on oxygen or not right now, because with pulmonary disease, unfortunately, it is progressive. And so it is very likely or possible that you will end up on oxygen later down the road. So when that time comes, it's really important to know the different types and kind of the do's and don'ts and have a basic understanding. So there are three types of oxygen. One is a tank. So these are the tanks that you see all over the hospitals, kind of people rolling around or in a backpack. These are 100% pure oxygen compressed into a tank. So this, you're not going to get 100% oxygen. It just means it's 100% pure oxygen. So you're getting a higher percentage of oxygen when you're on a tank than you do with a concentrator. The concentrator, there's two main kinds of concentrators. One is a stay-at-home concentrator or a standard concentrator. These plug into the wall. And the way these work is they're pulling air in from just the atmosphere. And our air is made up of mostly nitrogen. So there's 21% oxygen and about 78% nitrogen in the air. So the machines, they pull the air in and they have a nitrogen washout filter. So what they do is they scrub out that nitrogen and deliver a higher percentage of oxygen. So you get roughly anywhere from 90 to 95% purity on that oxygen. And then a portable concentrator works the exact same way. It's just a smaller version and it runs off of a battery, or you can plug it in and use it that way. There's also liquid oxygen, but you're not going to see these usually in home care very often. Patients generally don't get these anymore because it is the reimbursement, unfortunately, has decreased to an extent where it's not feasible for this anymore. You will see these in the hospital though. So if you're in the hospital and you're working with therapists, you may be on a liquid oxygen tank or compressor. And then if you're driving down the freeway and you're passing Deaconess and you look over and you see the big Norco tank, big white tank that says Norco on it, that's an oxygen tank. So that is liquid oxygen in there. Couple things to remember with oxygen. Biggest don't is don't smoke with your oxygen on. Now I can stand here and tell you to stop smoking all that I want to, but that is easier said than done. So I do recommend patients try to quit smoking. That is the best thing to do. But if you do smoke, you need to take your oxygen off. Wait a couple minutes for that to kind of dissipate away from your face before you smoke a cigarette. And the reason for this is oxygen is not flammable, but it is an accelerant, which is why they tell you to stop, drop, and roll. And that's why they tell you to smother fires, because you're trying to pull the oxygen away from them so they go out. And so when you smoke, you are giving the other three things that you need for a fire. So you need oxygen, heat, and a spark. So once you have those three things, a fire will ignite. And the fire will accelerate or go really quickly with the more oxygen in the air. And when you're on oxygen, it does pool around your face. So you do get quite a lot of oxygen just pooled into your face. And so you need to take that off and let it go for a little bit. I have had patients when I was not working here that have smoked cigarettes and it did light up and it burned into their skin, and they already had a lung disease and now they have all of that ash and everything into their lungs, which is just going to make it a lot worse. So definitely do not smoke with your oxygen on. Other things, make sure your oxygen stays at least 5 feet away from any heat source. So this is going to be baseboard heaters, wall heaters, furnaces, stoves, anything that has a source of heat. You need to keep it at least 5 feet away, and make sure you're also paying attention to your oxygen tubing so it's not getting close to those things as well. And then keep it as far away as possible from any open flames or any fires. So fireplaces, a lot of people forget about candles, incense. Again, if you have a grill, if you have a gas stovetop, anything like that, you need to keep it as far away as possible because it will accelerate a fire, make it spread a lot faster. Make sure you turn your oxygen off completely when you're done using it. The reason for this is when you leave your oxygen on, so you take it off, you throw it on your bed before you leave the house and you've left it on. Two things happen. One, you're using up that washout filter a lot faster, so you're going to wear that machine down a lot quicker. And then two, it's going to sit on your bed and then the earth shifts just right and it slides across a little bit. And what happens is it can spark and it can start a fire that way. So it's just best to turn it completely off when you're no longer using it for both of those reasons. And then make sure you have backup tanks available. So if you're on oxygen, make sure that you have tanks available to use for if you have a power outage, especially if you're 24/7. If you do not have a backup tank and you are on oxygen 24/7, definitely reach out to your home care company to get one. And then if you do have a power outage and you don't have a generator, I recommend calling your home care company and requesting a lot more tanks, and they can do that. They do have an emergency protocol in place for major power outages or any power outages where they will call all the patients in that area that is out of power, see if their home has power or not, and if not, they will deliver tanks as needed for patients. If you are unable to get tanks because they ran out, so with the big windstorm we had in 2015, I believe it was, that big windstorm caused a lot of power outages for an extended period of time. And so a lot of home care companies started running out of tanks. If that happens, call 911 because they will have oxygen on board to get you into the hospital, and then go into the hospital because the hospital will make a bed for you because oxygen is life-saving, so don't go without it. They have also protocol or programs to help get you into like a hotel with power or something along those lines. They have different ways to help get you the oxygen that you need if you're not able to get it in a different way for some reason. And then make sure your smoke detectors and carbon monoxide detectors are working at all times. So you should be testing them monthly. And there should be a smoke detector outside of every bedroom. And there should be a carbon or a smoke detector inside every major room and a carbon monoxide detector outside of every bedroom. And they should work. You should be testing them regularly for that. If you don't have those, if you don't know if they're working, you're not sure how to use them, call your local fire department. They are more than happy to come out and check them or install them. They also have programs if you can't afford to get them for you because they would much rather do that than respond to a fire, especially in a home with oxygen in it. Same with having a fire extinguisher. So make sure you have a fire extinguisher available and you know how to use it and it is full and it's not expired. And then same thing, if it is or you don't have one and you can't get one, definitely call your local fire department because they do have ways to help you with that. So the other don'ts are going to be no petroleum-based jellies. You need to use a water-based lubricant. So oxygen, when it's sitting in your nose, can be really irritating to the skin. It can be really drying to the nostril. And we don't want to use anything like Vaseline or any petroleum jellies for that because, again, that's not safe with oxygen on board. So what you would want to do is use a liquid-based. And they do make some specific for oxygen, patients that are on oxygen that your home care company, I'm sure, has available. The other one that is the most readily available is KY jelly. So that is what I usually recommend to patients. It's usually the cheapest, easiest to get. So you're able to use that a lot easier. And then don't try to fix your machine yourself. Don't try to oil it yourself. Call your home care company. Even if it goes out in the middle of the night, call them. They have people on call to come and fix it. Because like I said, it is life-saving. So if it's not working, call them. They will come out and either they'll troubleshoot over the phone, and then they'll come out and either replace it or fix it for you that night. And then no hairsprays or air fresheners, nothing like that. All of those, again, are accelerants. So, or those are all flammable, and then oxygen is an accelerant. So we don't want to combine all of that together because you're just increasing that risk of a fire. And then, like I said, try to keep it away from cooking areas and everything like that. Now, traveling with your oxygen. So you cannot take tanks on an airplane because compressed airplanes and compressed tanks, those don't mesh well. So you do have to have a portable oxygen concentrator if you're going to fly. And I always tell patients, call ahead, make sure you have what you need for that, because it really is important to know what your airline recommends or requires for you to have oxygen on board. Most of them are going to require you have twice as much battery life as flight time. And the reason for that is if they have a layover or a delay, or if they have to circle for a while for some reason, they don't want you running out of oxygen. You may also have to use a higher concentration on an airplane because it is compressed at a higher elevation, which makes it a little bit thinner on the airplane. So there's usually less oxygen in the air. Most other places that you're traveling, you can bring whatever you want. If you have your tanks in your car, I definitely recommend that you don't let them roll around. So they shouldn't be in your trunk. They shouldn't be rolling around on your floor. And the reason for that, and the reason we don't let them just freestand, they need to be in some sort of secure container so they're not going to tip over, is because on the tip of that concentrator or that tank is a little valve. And that little valve, if it tips over and gets hit just right, can break. And those tanks will become torpedoes. I've seen them go through 5-foot concrete walls because they're 2,200 pounds of pressure behind them. So they can go really, really fast through things. And that's just really unsafe. So always have it secured in some way. If you have it in like a bag or something, lay it on its side on the floor. Make sure it's not going to fall in any way. And then never let your tanks roll around in your car. You can store your oxygen outside if you have tanks. It's not going to hurt them to be out in the cold or the heat. Your home care company also stores them outside, so that doesn't affect them. The regulator, however, definitely make sure that's inside. Don't leave it in your car because they don't work as well when they get really, really cold or really, really hot. That is everything. There's one more note. Make sure you have your prescription with you at all times. So you can get your home or your oxygen prescription from your physician. You can get it from your home care company, wherever you want. They usually update it once a year. And I recommend you have this because oxygen is FDA regulated. And so if you don't have a prescription and you go somewhere your home care company does not service, you are not going to be able to get oxygen without a physician's prescription. They are unable to sell it to you without that. Even a cannula, nothing, even if you're self-paying. So if you were to have that situation happen and you don't have your prescription, you're going to have to go into the hospital to get a prescription. And nobody wants to have to do that, especially if you're on vacation. So I just highly recommend you always have your prescription on you, get an updated one every year, and just keep it in your wallet or your purse somewhere with you at all times so you have it available if ever needed. If you have any questions on your specific oxygen or anything else, please feel free to ask. Thank you.